Hi, so let us talk about cycling injuries today. Now, as you can see, these days more and more people are on the cycles and they're cycling more frequently for longer distances, maybe a mountain bike or a racer bike, but it's becoming an activity of choice to many. At the same time, we are also seeing an increase in number of cycling related injuries. So of course, cycling related injuries can happen in the upper limbs or in the lower limbs. For example, in the lower limb you can have Achilles tendinitis, you can have patellar tendinitis, sprain and strains of the muscle, and of course in the upper limb you can have pains in the wrist. You can also have back related problems, maybe the cervical neck or the lower back. But one particular injury that I want to emphasize is from the orthopedic perspective, it's the high incidence of clavicle fractures after a fall. So typically when an accident happens and a rider is falling off the bike, the first instinct is to try to break the fall with the outstretched hand, and often this can relate to some kind of injuries in the wrist, in the elbow, or even in the shoulder. And most of the time when they fall on the shoulder, the clavicle succumbs to the injury and typically you get a collarbone fracture. Now, collarbone fractures often are treated conservatively, but there are times where you may need to consider surgical treatment, especially if the displacement is rather significant. So the entire purpose here is to basically highlight this as a reason that we should be cautious when we are cycling and take adequate preventive measures. Of course, first of all, we should ensure that we are geared correctly. We should wear a helmet and ensure that we are padded well enough in our upper limbs and lower limbs, especially when we are doing cycling as a activity in a rather frequent manner, and especially when we are riding in the environment, may it be the roads or uneven grounds. So always be mindful of injuries, and in order to prevent such injuries we should build ourselves up in terms of stamina, making sure we are hydrated well enough. Get your bike fitted by a professional in terms of your height of your seat, the handlebar, and many other configurations to make your cycle optimum to you. And of course, if you're cycling in the night, make sure you have adequate lighting, because sometimes you can fall over a twig or even a pebble, and because of losing control you can fall and succumb to a rather serious injury. Now, these are basic fundamental preventive aspects that we should all try and adopt. And of course, besides this orthopedic injury which I mentioned about, there can be many other injuries depending on how one succumbs to a fall from a cycle. You can have head injuries, you can have injuries to the chest, to the abdomen, and the list continues. So therefore, as a cyclist, be mindful of the injuries that can happen and always take the appropriate preventive measures. Thank you and stay safe.